So welcome everybody. Thank you so much for joining us on a Friday before a long weekend. My name is Anne-Marie Edwards, and I'm the director of the Center for Cancer Prevention and Support at the Canadian Cancer Society, together with our partners at the Canadian Cancer Survivorship Research Consortium, the Canadian Institutes for Health Research, the Alberta Cancer Foundation, and McMaster University. I'm happy to welcome you to our next webinar installment. For those of you who have attended previous sessions, thank you so much for your ongoing participation. I also wanted to acknowledge that I'm coming to you today from the traditional territory of the Wendat, the Anishinaabe Nation, the Haudenosaunee Confederacy, the Mississaugas of Scugog, Hiawatha, and Alderville First Nations, where I have the honor to live, work, and play. So, for those of you who are team members of the Cancer Survivorship Team Grants, you might recall that coming out of the needs assessment that we did last year, we identified that there were 3 themes that you wanted to hear about. Those being building implementation capacity, equity, and sustainability. And as a planning committee, we acknowledged that we would seek out opportunities to partner with other organizations and existing events that are aligned with these themes. So I am happy to share that this is the first joint webinar that we are officially co-hosting with CCSRC today. Of course, we plan to continue with our quarterly webinar frequency, as well as the other initiatives that you know about that we've shared previously, like our trainee substream and common implementation indicators working group. But for today, I'm excited to bring us all together for a presentation on sustainability planning. So before I officially introduce our featured presenter, just wanted to take a moment to remind you of a couple of housekeeping items. You'll notice again that we're using Zoom today, so please, during the presentation, if you wouldn't mind muting and turning off your video to optimize the audio and video quality for everybody else. But definitely feel free to use the chat throughout the presentation, but also throughout the Q&A period, or when we tell you to, you can raise your hand and we'll call on you for questions. Athena Nicholas from CCSRC is going to be moderating the chat today. If you're having any technical difficulties at any point, feel free to either direct message her through Zoom or email her at the email address that's on the screen right now, athena.nicholas@uhn.ca. As always, we will have an evaluation survey for you as well for this event, and would kindly ask you to take the 3 or 4 minutes it takes to provide your feedback, as it really helps to inform our planning and improve future activities. So with all that said, it's now my pleasure to introduce Dr. Robin Urquhart, our featured presenter for today's webinar. Some of you may have seen Dr. Urquhart's keynote presentation last spring at our workshop, where her and Jackie Bender provided an introduction to sustaining innovations in cancer care, where she provided a little bit of the evidence base, as well as associated barriers and enablers. As a continuation of that discussion, really, Robin is back today to take us to the next step and help us learn about where to start. So Dr. Robin Urquhart is an associate professor and the Canadian Cancer Society's endowed research chair in population cancer research in the Department of Community Health and Epidemiology, with cross appointments in the Department of Surgery and Division of Medical Education at Dalhousie University. She's also a senior scientist with the Beatrice Hunter Cancer Research Institute and an affiliate scientist at Nova Scotia Health. Dr. Urquhart is also the Nova Scotia lead for the Terry Fox Research Institute Marathon of Hope Cancer Centers Network, that's a mouthful, and scientific director of the Atlantic Partnership for Tomorrow's Health, otherwise known as Atlantic Path. Dr. Urquhart is a health services researcher and implementation scientist, spanning the entire cancer continuum from primary prevention through to survivorship and end-of-life care. Her research examines issues related to access, quality, equity, and effectiveness in cancer care and control, and investigates ways to improve care delivery and resultant patient, family, population, and health system outcomes. So welcome back, Robin. I will now bring up your deck and hand it over to you.
Okay, thank you, Anne-Marie. That is a mouthful. I have to say, I always think when I hear my own bio, how much my kids would laugh about it if they heard it. Thank you, everybody, for attending today. So I'm going to talk about sustainability. Where and how do I start? Unfortunately, my computer's not working, so I'm joining you by my phone. So I don't have full access, but Anne-Marie will go through the slides for me. Next slide. First, I did want to do a land acknowledgement. So I'm here in beautiful sunny Halifax today at Dalhousie, and Dalhousie University sits on the ancestral, unceded, and unsurrendered territory of the Mi'kmaq Nation. As peace and friendship treaty beneficiaries, we have a responsibility to continuously educate ourselves and work in solidarity with Indigenous communities. We also recognize the histories, contributions, and legacies of the African Nova Scotian people who have been here for over 400 years. We recognize that without action, acknowledgement is empty, and it marks the beginning of the work ahead of us, not the end. Next slide. So what I want to do today in the next 40 minutes or so is the first half will be a little bit about what we know, just a few key articles and insights from sort of the literature around sustainability. Maybe talk about as we go through that where some of the ongoing challenges are right now, and then really get into where and how to start. So introduce you to a number of frameworks, tools, guides that help you plan for sustainability, and some sort of tips or some advice, I guess, to start using those tools. Next slide. Oh, and there is a little bit of this, Anne-Marie. Sorry, I thought I'd have my own, anyway, it is what it is. So first, let me tell you a quick story. So this doesn't have anything to do with cancer, but for those of you that work in hospitals and in any, or have worked in any sort of frontline or acute care setting, hopefully it resonates. So more than 10 years ago, actually, I think it was 2011, I was brought into a team. I was asked to sort of come into a more of a clinical team of allied health professionals and nursing staff and so on, to develop an intervention to address what at the time, we were in Capital District Health Authority here in Nova Scotia at the time, but it was to really address what came out in one of their needs assessment as the greatest challenge of frontline healthcare professionals in 2011 or so more than a decade ago. And that was dementia care and managing responsive behaviors in acute care. So on surgical units, medicine units, general medicine units, and so on, was really staff were really struggling, and they said that was their biggest challenge. So we got a team together. This sort of team invited me to work with them, and we did a whole lot of work to design an intervention, and then got actually peer-reviewed grant funding to evaluate that intervention. And we had qualitative and quantitative measures and so on. But the intervention was a multifaceted intervention, and it was, I'm going to say, it's education and training largely, and there was a toolkit associated with it as well. And we did this in quite a few acute care units here in our health authority at the time, what our health authority was. We did have some funding so we could study the sustainability of what we did, or of our intervention, or any outcomes of our intervention, for 1 year. So not a long time, but that's all the grant would allow for, right? So we sort of studied the sustainability of our outcomes primarily 1 year after the intervention. So next slide. So no, just behind there. Yeah, so essentially we had got together, we put a lot of work into this, a lot of care, a lot of thought. The intervention, obviously, I'd said, addressed a high priority concern of clinicians. We had evidence-based practices to address sort of dementia care, or to address responsive behaviors. So there was an evidence base there. the intervention was theory-based. It was informed directly by clinicians. We pilot tested it, we refined it. It was co-designed with researchers, clinicians, a health system decision maker, the chief of nursing at the time. And we designed and sort of implemented, I guess, or carried out a theory-based evaluation. So what we found, we did all of this work. We had a whole bunch of measures, things like inappropriate medication use on these units with this population, the cost of sitters or one-on-one care, a whole bunch of things, referrals to different services. And what we found when we looked at all of our data was that for most units that we did this intervention on, for most units, we did see direction, our outcomes changed, and they changed in a beneficial direction. So sitter costs went down, for example, inappropriate medication use went down for about 4 months on each of the units. 4 months or so. And then we started to see it come up again and up. And then by the end of the year, back completely to baseline levels for the most part, with the exception of a couple of units. Next slide. So we said, okay, well, what's going on? And so we built in sort of a post-op sort of mixed methods evaluation to figure out why we didn't see those sustained benefits, what was happening. And there were 3, and this was a mixed methods evaluation again, and there were 3 things that came out very clear. I don't even know if we had to do really the full evaluation. One of them is that sustainability was hindered hugely by high staff turnover. So I'm not a clinician, I'm a PhD scientist, always at an office in a hospital, but don't work on, I've never worked on acute care units, right? But staff turnover was unbelievable. In fact, in some of the units, in many of the units actually, 1 year, actually within 6 months of delivering the intervention, most of the staff that had taken part were already gone. So nursing staff, allied health professionals. The other part was there wasn't a lot of support from unit managers. So the health services managers on the units. And that was sort of, if you think about it, staff are not going to have a lot of incentive to engage in the intervention and to do these evidence-based practices, if your manager doesn't really believe that, or expect you to do it, or really doesn't, care if you do it or not. And the other thing that was clear is that this is a culture change. So we're in acute care, it's a post-op environment on a surgical ward, let's say on a surgical unit. And dementia care or managing responsive behaviors is just not a part of acute care culture, right? And so really, we needed a lot. We needed to address culture issues and so on in a much more substantive way. So I bring that up because that was a complete, in some ways I like that example because it was we learned a lot. I think we learned way more about implementation and sustainability than we would have if we were actually, if the intervention worked or was sustained over time. Next slide. So the sustainability of interventions, it has been described as one of the least understood and most vexing issues for implementation research. Next slide. I think we just need to have I'd like to have a bit of an understanding of what we mean by sustainability. So when I pose the question, what is sustainability? There really is no one answer. There is no agreed upon sort of definition in the literature. There have been attempts at definitions. There was some really good work done by Julia Moore a number of years ago, but there's no consensus definition, and it's all over the place. So, there was a review paper, which I'll show you later, in 2019 of sustainability strategies. And I think more than 60% of the studies included in that paper didn't even provide a definition in their paper. Can you click again, please? What we tend to see, though, is 1, 2, or 3 of these things. So people define sustainability in terms of continued capacity. So it could be workforce capacity. People have maintain their skills to be able to carry something out, or infrastructure has been maintained, and so on. Continued activities. So essentially, is the program still running after the implementation period or after that initial funding period? Are people still doing X or Y or whatever that is after usually it's after the funding period is ended, or the pilot period is ended, or whatever that is. And continued benefits. So our benefits to patients, or our benefits to the system, being maintained. Next slide. It also might change depending upon who you ask. So next. So this is, and I know that some of you have seen this already. I won't go into any detail, but this is a paper that myself and Dr. Jackie Bender and others published a few years ago. We were looking at sustainability of cancer survivorship interventions across Canada. But as part of that work, we asked people who were implementing these interventions on the ground, we asked them what sustainability meant to them. Like, we're studying sustainability. So it was a very open-ended question, and we were curious. So for people, who are actually implementing these things in hospitals or in community settings or wherever it is, what does sustainability mean to them? Next slide. And what we found was very similar to what you see in the literature. Everybody talked about, actually, I think it was literally across the board, continued capacity. So whether the things are in place, including sort of skilled workforce, but whether the things are in place to actually still be able to deliver the intervention, whatever it is. The next was continued delivery. So again, continuing to deliver the program, the intervention, the exercise program, the transitions classes, whatever it was. Past that initial funding period, and again, continued benefits. There were a few nuances though. So I wonder if you could just click again. Okay, so the first was that people really talked about the fact that it's not just continued delivery, but the intervention or the innovation has to continue when the champion is gone. So one of the things that we found in all of our work was really the importance of champions, and we'll talk about that in a few minutes in terms of sustainability. But people saying, until the, so-and-so is left, or until, so-and-so is retired, or Dr. X is left, we really don't know if it's sustained. So it has to continue in the absence of that champion who's been like leading it for the past, 2, 4, whatever many years. And then the other part was that we only care about sustainability if the interventions or innovations are still needed. That might sound funny, but it's interesting because I don't think it was this understanding that if the intervention is not needed, then we need to figure out how to de-implement or de-adopt things. And that we don't have a lot of that language or a lot of that thought in the sustainability literature. And then the next was continued benefits. So adaptation was seen as absolutely critical, fundamental, to sustainability and to optimizing the benefits of whatever the intervention was. And so that we'll talk about adaptation again in a little bit. And then sustainability for many was contingent on being able to demonstrate the benefit. So being able to show long-term success. Next slide. So why is this important? Well, might seem funny to say, but if we don't sustain programs, first of all, I think we've wasted money. We've wasted a lot of people's time. We've wasted resources and so on. And most importantly, our patients don't receive the best care that they can. So that's why all of this is important. Next. When we look at the literature, we see that a lot of programs aren't sustained after a big implementation period and so on. So there's a couple of references here, but we often see in self-report measures that up to 60% of programs are sustained, at least in part. So these are numbers from the literature. But studies that have used more objective measures report lower rates of sustainability. So often, it's been as low as 6% or so to 45%. Next slide. So I'm going to talk about 2 papers, then we're going to go into planning. These are just 2 recent papers that I wanted to highlight. And the first is the sustainability. It was a systematic review on essentially the sustainability of hospital-based interventions. And I bring this one up because I think a lot of the interventions that folks on the call are working on are hospital-based, but certainly not all. And so this was, again, a systematic review. And you can see here that interventions continued to be delivered in just over half of the studies. So just over half were sustained, and that they continued, the activities were maintained. Individual behavior change, so most like healthcare provider behavior change, was maintained in just over a quarter of studies. And interventions continued to produce longer term benefits in just over a quarter of the studies that were in this article. Next slide. If you look at some of the main barriers and main facilitators that came out in this article, the top 4 barriers right there, again, staff training and knowledge. Do staff have are the workforce trained? Do they have do they have the right knowledge, the right skills to be able to maintain or sustain the intervention? Certainly workload pressures, a lack of strong leadership or support by champions, and staff shortages and or high staff turnover. So this gets back to the story I told at the beginning. One of the key barriers in all of the studies that were in this review, again, hospital-based, was high staff turnover. So if we go over to the facilitators, I won't read through all of these, but for sure, ensuring adequate training, and the article talked about, booster training sessions, ongoing training, and so on, again, because of the high staff turnover. Accountability of roles and responsibilities, supportive leadership, including strong champions, having appropriate infrastructure in place, especially around technology-based, so IT infrastructure and so on, having management on board, and being able to adjust or adapt the intervention as time went on to fit the organization, to fit the setting, to fit the patient population, and so on. Next. So I've just highlighted some of these, just to bring out sort of champions, leadership, training, adaptation, and so on. So next slide. And so what about sustainability strategies? So, for those of you that are sort of, aware of the implementation literature and implementation science literature, there's been a lot of work that's been done over the last decade or so to really, or more than that, the last 2 decades, to really study the impact of different implementation strategies. There's been a ton of work classifying, coming up with taxonomies of implementation strategies and building the evidence around those. So less so with sustainability. We don't know as much there at all, and this is sort of a really new field. Having said that, again, this was a systematic review published maybe a year ago or so, evidence-based intervention sustainability strategies. And so you can see here that the top strategies that have been used in the literature, one is, finding funding and or contracting to continue the use of whatever the intervention was. The other is the maintenance of workforce skills, training, again, ongoing training, booster sessions, and so on. Adaptation to increase the fit or the compatibility with the organization. And they make a note that it's not just like adaptation it's not just something changes, like it's planned adaptation, it's systematic adaptation, to make sure that you are changing or adapting or modifying the intervention, whatever that is, the program, the service, the tool, so that it fits with that setting. And then lots of different strategies, and a lot of this is communication and flag waving, like championing things, but really needing to maintain leadership buy-in and support. Next slide. So a couple of the other things that I just wanted to say is, it's clear in the literature now, and I hope I'm not giving the perception that sustainability is sort of a yes or no outcome, or that it's static. So sustainability, when we think about it, is really not a static state, it's ongoing. And it's really, how do you maintain capacity, maintain use of the program, continue to deliver benefits, so that you have long-term success, I guess. And so it's not static. It is going to evolve. Your intervention will evolve. The work you do will evolve. The setting, the organization will evolve. So it's not a static state. It might look different we don't know a lot about this, but I could hypothesize that sustainability might look different depending on the setting or the intervention itself. So for example, public health and community-based interventions may look quite different than that of medical interventions, right? Or the sustainability. I would think, looking at the literature, that public health or community-based interventions probably much more reliant, many of them, on networks and partnerships and that sort of thing, versus maybe a very tried and true medical intervention is a little bit different. And then the last point that I want to make here before we go into planning is that sustainability occurs, or I suppose it doesn't occur, within a really dynamic context. And this is the ongoing flag waving that you have to do as champions. And I know many of you here have done this, is that because there's going to be changes in funding, there's going to be changes in attention and in priorities of policymakers and decision makers, of governments and so on, and of public interest. And so it is this sort of, so there will be changes. Things aren't going to stay the same. So there is this ongoing promotion of what you're doing, ongoing demonstrating the value and so on for many different interventions. And I just want to bring up an example from Ontario, actually, in survivorship care. So, quite a number of years ago, based on some follow-up guidelines that were created by Cancer Care Ontario, there was sort of a big emphasis on transitioning, right? So transitioning breast and colorectal cancer patients or survivors back to the community and back to primary care. And so many different cancer programs put, maybe similar, but maybe a little bit different interventions in place to sort of ease that transition and to improve follow-up care. And then, priorities changed, funding changed, interest changed, and it was a struggle for some of those programs to maintain, or some of those services and programs, interventions to continue, and certainly to continue in the current state, or in the state that it was developed. Next slide. Okay, so the state of the science isn't where many of us might like it to be, but I think we do know enough right now. For sure, we know enough. We've known enough for a while to be able to act. Next slide. So I'm going to talk about planning and assessing for sustainability. Next slide. Okay, so how might you begin? So hopefully some of this is practical for you. There are a number of sustainability frameworks. I'll show you two. I'm not going to go through them in detail. I've included the references at the back of, as suggested articles for everyone. But there are a number of sustainability frameworks now that are out there that pull together everything that we know right now in terms of sustainability, like influences on sustainability and so on, that pull together into a framework. And so I find frameworks helpful, but I do know sometimes they can be, they don't feel very practical. So I'm an academic, I'm a researcher. So I've said, these may be better suited to research endeavors rather than sort of implementing on the ground. But I still want to, many of you are researchers, so I still want to show you the two frameworks. And then there are sustainability assessment tools and guides. And, maybe these are better suited, I think they are, to practice endeavors. I've used them in my research for sure as sort of assessment tools, but I've also used a couple of these, and I'll talk about them in the work I do here with the Cancer Care Program. So in terms of when we put new interventions or new programs in place, and we want to assess sort of capacity for sustainability and where efforts need to go to try and, improve the chances of success, right? Okay, so we'll talk about a couple of tools as well. So next slide. This is, my apologies, I know this is really hard to see. The citation to this framework is provided for you guys a little bit later. This is the Integrated Sustainability Framework. Because I'm on my phone, I can't see very well, but I'll try and actually, you know what? I have it up here on my computer. I knew I had my computer on here for a reason. So what you can see here again in this framework is that, basically there are these outer factors that may influence sustainability, but there's a lot of inner factors. So again, inside the organization is what I mean by inner factors. And, things that we've just talked about: champions, leadership and support, resources and funding, staffing and turnover. And then there are processes such as training and supervision, adaptation, program evaluation, and so on. So these are different determinants of sustainability that we know from the literature. And of course, you can see in the green part towards the right, different ways to think about sustainability, continued implementation, continued benefits, and capacity building. Next slide. This is going to be really hard to see as well, but the citation is going to be provided for you. So there's also the Consolidated Framework for Sustainability Constructs in Healthcare. I'm not going to go through this. I just want you to be aware that there are frameworks out there that can help you think about all of the different facets, I guess, or all of the different determinants of sustainability. Next slide. So there are also tools and guides. There's 3 that I'm going to introduce to you today. One is the Program Sustainability Assessment Tool. The next is the NHS, National Health Service, Sustainability Model and Guide. And the next is a newer tool, actually, the Long-Term Success Tool. Just click. And so there's less in sort of really, medical settings around this, but certainly we're seeing research more and more in community and public health settings that show that if you plan for sustainability from the beginning, you increase the chances you will actually sustain what you implement. Next slide. Okay, so I'm going to start with the Program Sustainability Assessment Tool. So this tool was developed to plan for sustainability, but to assess capacity for sustainability. It is targeted more at public health interventions than it is at sort of very clinical interventions. I have used it. I did put up this, so you can notice here there's the PSAT and the CSAT. The CSAT is their comparable tool for clinical interventions, which I haven't used, but I'm just going to talk about the PSAT today. So this is probably, and you can find it at sustaintool.org. This one probably has the most evidence behind it in terms of how much work the creators have done over the years. So it's based on a framework that was created quite a long time ago now, and in the literature. And so it probably has the most meat around it, I guess, and the most tools available. And so it assesses the sort of core domains. So it has 40 different questions, 40 items in these 8 domains. So strategic planning, funding, stability, partnerships, organizational capacity, program evaluation, adaptation, communication, environmental support. If you were to go online with your team, you can do this whole assessment online. Right after you do the assessment, you review your results. You can review your results. You can see your results. They also have a really nice part of their website. And so this is all free. They also have a really nice part of their website where you can develop an action plan based on your results. So they give sample sustainability plans. They give sample templates, they give you templates to get you started developing your own action plan or your own sustainability plan. They give you different tips. They suggest certain sustainability strategies depending on your results and so on. So it's a really nice site. And I think it is worth if you're leading sort of big intervention initiatives, whether that's through research right now or in sort of a clinical setting or a community setting, it's worth checking out this site and these tools. Next slide. So the next is the NHS Sustainability Model and Guide. I have used this one in the past. I would say this is more targeted for clinical interventions. So again, to plan for and assess your capacity to sustain clinical interventions. You can find the tool online if you just Google it, just the Sustainability Guide. It is a self-assessment tool that basically asks questions around 10 key key factors, underneath staff, organization, and process. It does you can get a total score so that you can track your score over time. You can do this. I've done this before as a team. So we've printed out, the sheets and or the tool itself and the guide and done it as a team over the course of a project that I'd been working on a number of years ago at Cancer Care Nova Scotia at the time. And we tracked our progress over a number of years and then, worked on those areas where you may be weaker in terms of sustainability or capacity so that you can maximize your chances of success again. Next slide. So this is the newer tool. I've not used this one. I have went through the whole tool. I went through the evidence behind it. There's some papers describing how it was developed and so on. It was developed out of one of the clerics, that's how you say it, out of the UK. So one of the one of the sort of teams that are around sort of integrated knowledge translation and health services and system work. And it was developed to be a more relevant and practical tool to assess sustainability compared to the NHS one that I had just shown you. Again, this is sort of available online. They have many tools to help you. So there's the assessment itself. You can see what it assesses there, sort of 12 core domains. But they have a framework with additional reflection questions. They have they even give you, Excel spreadsheets so you can track your progress over time as a team. There's a process that they suggest to go through. The first, all team members individually would do the assessment. Then you get a report, and then you sort of have a team discussion and activity, and use that, right, to be able to develop sustainability strategies. I do bring this up. Also, some people may be familiar with it. So it's a relatively new tool, but I do know that it's used by the Canadian Foundation for Healthcare Improvement, CFHI. So CFHI has a full guide to use this tool. They have a ton of resources also to be able to use this tool. So this is one of the ones that they use with their projects. Next slide. So tips for using these assessment tools. I would say start early. They're actually really helpful. So start as early as possible. Like if you're working on an intervention that you're hoping will last, go past that pilot funding stage or go past the research stage, right, and actually be integrated into, whatever setting it is, whether it's a hospital, whether it's primary care, whatever. They're very helpful to get a good sense of where you need to put some effort to make sure that the intervention is going to, be maintained after that, funding is over. I would engage the entire team in using these assessment tools. There's no wrong or right way to use them per se, but there's guidance for the three of these, but use the entire team, entire interdisciplinary team to sort of get a really good understanding of, where some risk to sustainability might be, for example, and what you might, need to do. It is recommended that you use them regularly. So, if you go in and look at these, they often say every 3 months. I'm saying every 6 months. Oh my goodness, how hard is it to get everybody together every 3 months to go through this? I've done it before every 6 months, and it's worked well. They allow you to assess your progress, and they allow you to identify any sort of emerging risk, and then to be able to, again, take action. The other thing that I've put on here, I suppose it's not a tip for using assessment tools, but if you're thinking about it now in a research context, I really do encourage you, as the interventions are being tested and then maybe implemented later, taken on by organizations, to document and report on adaptations. Because we don't know a lot. We know adapting interventions are important, and I'll talk about that in a minute, but we don't really, we don't document that, and we don't necessarily report on those, but that's really helpful for other people. Like if someone is, reading about the great work that you're doing and this intervention that had these benefits, and, you've done it in wherever, it's been done in Sudbury, or it's been done in Toronto, or it's been done in Vancouver. It's very helpful for implementers elsewhere to be able to understand what was adapted and how that was done to be able to fit, again, with local settings. Next slide. A place to start. So, as teams and as research teams, I kind of have these two questions here. Like, you might just start, if you're thinking about sustainability and how to think about it, those tools, if at some point you think you're ready to do an assessment and maybe to incorporate that into, a team meeting every 6 months or something, or even, whatever that is. But you might also just start by asking a few questions. Right. And one of those, I think, is, what does long-term success mean for your project? What does sustainability mean? What would it mean? And then, are there any sustainability issues that might be unique to your project or your setting? And being clear, that, what are they? And being clear about those and what those might be. So again, you can work on it. Next slide. So final but important points. So I think I've reiterated this. This is just reiterating what I've just said, but planning for sustainability, I would say, is a process, not a one-time event. Again, the science is underdeveloped, but there is a lot of, really good researchers studying really important issues on this right now, and we're going to get more and more evidence. But I think from a planning perspective, it's not a one-time event, because things change, your organization change, new leadership comes in, new staff come in, new evidence appears for your intervention. So it's not a one-time event. And adaptation will be necessary for many interventions. And I say this because I know many of us who are trained more in like classical sort of epidemiology, maybe, or like we often think an intervention has to be like, it's in our head that it has to look exactly the same in every setting. I think that's not going to work very well for not only for implementation, but for sustainability. So I think it's important to understand that adaptation doesn't mean that you lose fidelity completely, or that your deviations from like your intervention are a bad thing. Many adaptations are actually really beneficial, right? They're really beneficial for the setting. They're really beneficial for patients. Next slide. So I took this from a paper that Jackie and I and others had published around survivorship interventions and the sustainability. And so you can see, largely speaking, these were in Canada. You can see, largely speaking, there were, we tried to group like 5 different types of interventions that we had, or innovations that we had studied. But we asked people whether and how they had adapted them. So you can see many of the examples here of adaptations. We're not talking about, changing the program entirely. We're thinking about changing how you deliver maybe the program, right, to make it more suitable or palatable for patients. You're thinking about maybe adding some different sessions that you realize are really important, or, different referral processes to the program. So you're not really changing the core of it most times in terms of adaptation. You're really changing or adapting delivery modes, or adapting maybe some of the content because of your local setting, or the way you deliver that content, or the way you capture people in your program, or so on. So I just wanted to bring that up there. I think that's about it. Next slide. Okay, yeah. So here's some suggested articles. I'm really happy for from my slide deck to be shared, or for us maybe just to send everybody these articles or something. So just a few articles to get started in case you're interested. And then the next slide should be the end. All right, yeah, questions and discussion. So